Have you ever stopped to think that your bedtime routine might actually be putting your life in danger without you even realizing it? It may sound shocking, but the Centers for Disease Control and Prevention reports that over 70,000 older adults pass away in their sleep each year in the US alone, the alarming part. Many of these deaths aren't just due to aging, they're connected to small, preventable nighttime habits that most people don't even question. After age 60, your body changes in subtle but serious ways. Your heart becomes more fragile, your lungs more sensitive, and your brain more reactive to disruptions. Sleep gets lighter. Your muscles aren't as strong, and what once felt harmless before bed can now quietly turn dangerous. Yet most older adults keep doing what they've always done. Without realizing, these routines might be quietly harming their long-term health and safety. So what exactly are these silent threats hiding in your nightly habits? Which common bedtime mistake leads to more nighttime emergencies than any other? And more importantly, what can you do right now to make your sleep safer and healthier? In today's video, we're diving into 7 nighttime habits that have already claimed the lives of many seniors. This year, you'll want to pay close attention to habit number 2. It's surprisingly deadly, but don't worry, I'll also give you simple steps to protect yourself. Starting tonight, if you're new here, welcome to the channel. Let's grow stronger and healthier together. Be sure to like this video and hit that subscribe button so you never miss our next update. And hey, drop your country in the comments so we know where you're tuning in from. We love seeing our global community grow. Now, let's begin. Habit number 7, drinking too much water before bed. Let's talk about one nighttime habit that seems harmless, but could quietly be putting your health at risk. Drinking too much water before bed, staying hydrated is vital. Especially as we age, water keeps your organs functioning, supports digestion, and helps your joints stay flexible. But while drinking enough throughout the day is important, loading up on water right before bedtime can backfire. Especially for older adults, as we get older, our kidneys slow down in processing fluids, and the bladder doesn't hold as much as it once did. On top of that, the signals telling us we need to use the bathroom become more sudden and frequent. So if you're drinking a lot of water, or even juice or herbal teas within an hour or 2 of going to sleep, your body is more likely to interrupt your rest with urgent bathroom trips. Now, waking up once or twice might not seem like a big deal, but for seniors, it increases the risk of nighttime falls. Picture this: you're groggy, the room is dark, your balance isn't what it used to be, and standing up quickly lowers your blood pressure. That quick trip to the toilet could turn into a dangerous fall. In fact, the CDC reports that falls are the top reason older adults end up in the hospital. And many of these accidents happen during nighttime bathroom visits. But that's not the only concern. Repeatedly waking up to urinate breaks your sleep cycle, especially the deep stages that help restore brain and body function. Chronic disruptions in sleep have been connected to memory loss, higher inflammation levels, and a greater risk of conditions like dementia and Alzheimer's disease. Poor sleep can also weaken your immunity and worsen conditions like diabetes and high blood pressure. There's also an added heart risk. Consuming too much liquid at night means your heart has to work harder to manage that extra volume for someone with existing cardiovascular issues. This can trigger irregular rhythms or strain the heart unnecessarily. So what's the best way to hydrate safely? It's all about timing and balance. Drink enough water during the first half of the day, then start cutting back in the evening. Try to avoid heavy fluid intake at least 2 hours before going to sleep. If you feel thirsty before bed, limit yourself to a few sips instead of a full cup, and avoid caffeine or diuretic drinks like black tea, coffee, or citrus juices. Late in the day, they'll only increase your bathroom trips. If you do need to get up at night, make sure your route is safe. Use night lights or motion sensor lamps and clear any clutter that could trip you up. Stand slowly, give your body time to adjust and move carefully. These small changes can help you stay hydrated without sacrificing sleep or putting your safety at risk. Habit number 6. Eating late at night, it might seem harmless to enjoy a little snack before bed, especially after a long day. But for older adults, this common habit could quietly disrupt your health more than you think. That late-night treat may feel comforting, but it can lead to a chain of issues that go beyond just a little indigestion. As we get older, the way our bodies handle food starts to change. Metabolism slows down. Digestion isn't as smooth, and managing things like blood sugar and cholesterol becomes more difficult. So when you eat heavy or rich foods late in the evening, your digestive system doesn't get the downtime it needs. Instead of repairing itself during the night, your body stays active trying to process that meal, which not only disturbs your sleep, but also puts added pressure on your heart, liver, and digestive organs. One of the most common problems from late-night eating is acid reflux. When you lie down after a meal, stomach acid can easily move up into your esophagus, causing that painful burning sensation in your chest. For seniors, this isn't just uncomfortable, it can lead to inflammation damage to the esophagus, and even aspiration pneumonia. If particles are inhaled while sleeping, a study in the American Journal of Gastroenterology found that people who eat within 3 hours of bedtime are much more likely to experience reflux and its related complications during the night. But that's not the only issue. If your evening snack includes sugary foods or refined carbs, it can spike your blood sugar levels as we age. Our cells become less responsive to insulin, making it harder to manage glucose properly. This can lead to type 2 diabetes or worsen it. If you already have it, a 2020 study in the Journal of Clinical Endocrinology and Metabolism confirmed that eating late is linked to higher morning blood sugar and insulin levels, especially in older individuals. There's also something you may not notice right away. Your blood pressure, normally it drops during sleep to let your heart rest. But if you eat late, especially something fatty or salty, it can keep your pressure elevated through the night, increasing the chance of a stroke or heart attack. In some cases, heavy evening meals may even trigger irregular heart rhythms, which can be dangerous for anyone with existing heart problems. So how do you enjoy your meals and still stay safe? The answer lies in timing and smart food choices. Try to finish your last meal at least 3 hours before bedtime to allow proper digestion. Opt for lighter balanced dinners with vegetables, lean protein, and whole grains, and skip heavy greasy dishes and sugary desserts. If you're genuinely hungry, later go for something small and gentle like a banana, a spoon of plain yogurt, or a few unsalted nuts. These options are easier on your stomach and won't spike your blood sugar by adjusting your routine just a little. You'll sleep more soundly and lower your risk for serious problems like heartburn, high blood sugar, and cardiovascular stress. Giving your body the nighttime rest it needs will help you feel stronger and healthier each day. Habit number 5, sleeping in the wrong position. Everyone has a go-to sleeping pose, whether it's curling up on your side or sprawling out on your back. But what many older adults don't realize is that your preferred position at night could quietly put your health at risk. As you age, the way you sleep can affect everything from your breathing and heart function to your brain health. Let's begin with one of the worst positions for seniors: sleeping flat on your back, also known as the supine position. While it may feel restful, this posture can trigger a chain of health issues. Lying on your back allows gravity to pull the tongue and throat tissues backward, narrowing the airway. This becomes especially concerning for people who snore or suffer from sleep apnea, but even without a formal diagnosis, this restriction can reduce airflow. Studies from the Mayo Clinic Sleep Disorder Center show that back sleeping can worsen breathing issues by as much as 40% compared to sleeping on your side. And the effects of that restricted airflow can be serious when oxygen drops during sleep. The risk of obstructive sleep apnea increases, causing repeated interruptions in breathing over time. This can raise blood pressure, lead to brain damage, and significantly increase the risk of heart attacks. And stroke research published in the Journal of Clinical Sleep Medicine found that seniors who sleep on their backs face a 22% higher chance of experiencing cardiac events at night than those who sleep on their side. But breathing issues aren't the only concern for seniors dealing with acid reflux or a hiatal hernia. Sleeping on the back can worsen symptoms. It makes it easier for stomach acid to move up into the esophagus, potentially causing silent reflux while you sleep. This can damage the throat lining and even raise the chance of aspiration pneumonia. If acid enters the lungs over time, repeated exposure can lead to esophageal cancer. There's also a growing body of evidence showing that sleep position affects your brain's ability to clean itself. A study by researchers at Stony Brook University found that sleeping on your back reduces the brain's waste clearance system by more than 60%. This system is responsible for flushing out toxic proteins, including those linked to Alzheimer's disease and dementia. That means poor sleep posture could speed up cognitive decline in older adults. Even sleeping on your right side has its drawbacks. It can compress major blood vessels near the heart, interfering with circulation and raising the risk of heart failure, especially in seniors with existing heart concerns. So what's the safest way to sleep? Experts agree that the left side is best sleeping on your left. Supports better circulation, promotes healthy digestion, and reduces acid reflux and stroke risk. It also allows your brain to clear waste more efficiently, protecting long-term mental function. Switching positions might feel awkward at first, but there are tricks to make it easier. Use a firm pillow between your knees to keep your hips aligned and tuck another pillow behind your back. To stop yourself from rolling over, a specially designed neck pillow can keep your spine supported and your head in the right position. If reflux is an issue, slightly raising the head of your bed can also make a big difference. Training yourself to sleep on your left side may take some effort, but the health rewards are well worth it. By adjusting how you sleep, you can lower your risk of breathing troubles, heart strain, and mental decline, setting yourself up for better rest and a healthier future. Habit number 4, sleeping in a hot room. We often seek warmth at night, especially as we grow older. It's natural to want to feel cozy, maybe by turning up the thermostat, layering blankets, or keeping windows tightly shut. But here's something many don't realize. A warm bedroom can silently put older adults at risk for seniors. The right sleep environment isn't just about comfort, it's about staying healthy and safe. Your body naturally lowers its core temperature to signal that it's time for sleep. This cooling down is what helps you enter the deepest, most rejuvenating sleep stages. However, if your room is too warm, typically above 20 digi, your body struggles to release heat. Instead of settling into rest, your system stays active, trying to cool down, which often leads to interrupted sleep, frequent waking, and feeling drained the next day. But the impact of heat on sleep goes beyond just restlessness. Older adults are more vulnerable because the body's temperature regulation weakens with age, according to findings published in the American Journal of Geriatric Psychiatry. Seniors who sleep in warmer environments get up to 30% less deep sleep. The stage essential for memory processing, immune support, and cell repair. Missing this vital phase of sleep can snowball into larger health concerns. Lack of quality sleep contributes to inflammation, elevated blood pressure, and impaired immunity. These effects increase the risk of serious health issues like heart disease, type 2, diabetes, and mental decline. The same research warns that persistent sleep loss due to heat may also speed up memory deterioration and leave the body more vulnerable to infection. Another hidden danger of a hot room is dehydration. Seniors often feel less thirsty and sweating during the night causes a loss of both fluids and electrolytes. This not only affects hydration, but can make the blood thicker, which raises the risk of blood clots, irregular heartbeat, or even stroke. For those with heart or lung conditions, the extra burden of heat regulation at night could spark serious complications, like heart failure or breathing distress. So, what's the optimal sleep temperature? Experts recommend keeping your bedroom between 15 degrees Celsius to 19 degrees Celsius. Choose light breathable bedding like cotton sheets and avoid heavy quilts or electric blankets that retain too much heat. If you tend to get chilly, go for layered blankets. You can remove easily a fan, or cracked window can help improve airflow and reduce trapped warmth. Keeping the room feeling fresh. Small changes to your sleep environment can have a big impact by cooling down your bedroom. You're not just making it more comfortable, you're protecting your heart, preserving your memory, and supporting better sleep quality for seniors. Maintaining a cooler sleeping space is a simple but powerful step toward healthier aging habit. Number 3, getting out of bed too quickly. Ever wake up at night, swing your legs over the edge of the bed, and suddenly feel lightheaded or like the room is spinning? You're definitely not alone. And it's not just in your head for older adults making sudden movements. When rising from bed can be more dangerous than most people realize. This one habit is behind countless falls, injuries, and emergency room visits. Every single year, the root of this issue lies in something known as postural hypertension, also called orthostatic hypertension. It happens when your blood pressure drops abruptly as you move from lying down to standing. As we age, our circulatory system slows down in adjusting to position changes, making it easier for blood to pull in the lower body. That momentary lack of blood flow to the brain causes feelings of dizziness, blurred vision, or even a brief loss of consciousness. This isn't just an uncomfortable inconvenience, it's a real threat. Research in JAMA Internal Medicine highlights that seniors with postural hypertension face a much higher risk of falls fractures, and even death falls remain the top cause of injury-related hospital admissions in older adults, with many occurring late at night or early in the morning, when the body is still adjusting after rest and blood pressure tends to be lower. And the fallout from one bad fall can be devastating. Hip fractures, head trauma, and broken wrists are among the most common injuries. Recovery is often long and painful, and for many, a single fall can mark the beginning of reduced mobility, loss of independence, or serious long-term health complications. That's why it's essential to treat this habit with the seriousness it deserves. Fortunately, preventing this problem doesn't require major effort. The most effective step is to slow down when you wake up. Take a few moments to sit upright on the bed, allowing your body time to regulate. Blood flow. Move your feet. Flex your ankles and breathe deeply. This gentle movement helps your circulation adjust and minimizes blood pressure swings. Keep a glass of water at your bedside and sip it slowly before standing. Especially if you tend to wake up dehydrated, safety in your environment matters too. Make sure your path to the bathroom is well lit. Using night lights or motion sensor lighting, avoid slippery socks and wear non-slip slippers. Instead, keep clutter and rugs out of walkways to prevent tripping if possible. Hold on to a dresser bedpost or grab bar for extra stability when rising. If you're on medications that affect blood pressure, such as diuretics or beta blockers, speak with your doctor. They may suggest adjusting your dosage or changing the timing of your doses to reduce risk. Just making these small changes to your nightly routine can greatly lower your chances of a dangerous fall and help maintain your independence and safety. So don't rush the moment you wake. Taking your time isn't just about feeling better, it's a critical part of protecting yourself as you age every single night. Habit number 2. Ignoring snoring, breathing pauses, or chronic insomnia. Many people dismiss snoring as a minor annoyance, especially with age. But what if that nightly noise or the moments where breathing seems to stop are signs of something much more dangerous for older adults? Brushing off these symptoms can lead to serious and even life-threatening health complications that often go undetected. One of the most overlooked yet hazardous conditions affecting seniors is obstructive sleep apnea. This disorder happens when the muscles in the throat relax too much during sleep, causing the airway to narrow or close. When that happens, breathing stops for short periods, sometimes dozens or even hundreds of times throughout the night. Each time it occurs, oxygen levels dip, forcing the heart to work harder and putting extra strain on the entire body. Over time, this repeated stress can cause high blood pressure, irregular heartbeat, and raise your risk of stroke or heart attack. Significantly, the statistics are eye-opening data from the Sleep Heart. Health study shows that sleep apnea, when left untreated, raises the risk of fatal heart attacks by 30% and strokes by up to 60%. In seniors, nearly 4 in 10 older adults are believed to suffer from sleep apnea, yet roughly 80% of those cases are never diagnosed. Many simply assume that snoring or frequent waking is part of normal aging, unaware that it may be a serious condition in disguise. But it doesn't stop at the heart, sleep apnea, and long-term sleep deprivation. Rob the brain of the deep rest it needs without proper sleep. Seniors may notice memory lapses, mental fog, and even signs of early cognitive decline. Some studies suggest that untreated sleep apnea can lead to brain tissue loss, especially in areas that manage memory and reasoning, occurring almost 3 times faster than typical age-related changes. So how do you know if sleep apnea or a related issue might be affecting you often? It's someone else. A spouse or caregiver who notices first key warning signs include loud snoring, gasping for air during sleep, long pauses in breathing, or waking up frequently. You might also notice morning headaches, a dry mouth, or feeling unusually tired throughout the day, even after a full night in bed, insomnia. Whether it's difficulty falling asleep or staying asleep is another important clue, while occasional sleeplessness is common. Chronic insomnia may point to underlying health problems, including heart, neurological, or hormonal imbalances. It also disrupts the immune system and raises stress levels, making conditions like hypertension and diabetes harder to manage. If these symptoms sound familiar, it's time to take action. Speak with your doctor or a sleep specialist. Treatments such as CPAP machines, lifestyle changes, and weight control can dramatically reduce the health risks. In fact, research shows that managing sleep apnea properly can cut the risk of heart-related events by as much as 42% in older adults. Snoring and sleepless nights aren't just irritating habits, they're serious health alerts. Addressing them can help safeguard your heart, support your brain, and improve your overall well-being. As you age, habit number 1, taking certain medications before bed. For many older adults, nighttime medication is part of a normal evening routine. Whether it's something for sleep, blood pressure, or joint pain, it feels like a harmless step before turning in for the night. But the truth is, some of these seemingly routine medications can pose hidden dangers when taken at bedtime, especially as we get older and our bodies process medications differently. Let's begin with sleeping pills and anti-anxiety medications. Drugs like benzodiazepines, including diazepam, clonazepam, and alprazolam, are designed to relax the nervous system and make falling asleep easier. But they also slow down breathing and reduce alertness for seniors, especially those with existing heart or lung problems. This effect can be risky. Research in the British Medical Journal shows that seniors who use these medications regularly are more likely to suffer from falls fractures and even premature death compared to those who don't. The grogginess doesn't just stay in the night, it can linger into the next day, causing unsteadiness, confusion, and a higher chance of dangerous slips or stumbles. And sleeping pills aren't the only concern. Muscle relaxants and some antidepressants, often prescribed for night use, can interfere with the deep stages of sleep your brain needs to stay sharp over time. This lack of quality rest may contribute to memory problems, mental fog, and even speed up cognitive decline. Pain relief medications also deserve caution. NSAIDs like ibuprofen and diclofenac, though effective for sore joints, can stress the liver and kidneys when used frequently. Especially at night, they can also increase the risk of internal bleeding, particularly if you're taking other medications that affect the blood. Another common nighttime drug is for high blood pressure. While some people benefit from taking these medications at night, others may experience a sharp drop in blood pressure during sleep. This can reduce blood flow to the brain and trigger symptoms like dizziness, fainting, or even a stroke. A study published in Hypertension revealed that the timing of blood pressure meds greatly affects nighttime heart health, and not everyone reacts the same way. Let's not forget about drug interactions as we age. Our metabolism slows, making it easier for medications to build up in the body. Taking a mix of sedatives, painkillers, or heart meds without clear guidance can have dangerous or even life-threatening consequences. So how can you stay safe? Always talk to your doctor or pharmacist before starting, stopping, or switching medications. Ask if there are non-sedating alternatives, especially if you're experiencing drowsiness, mental fog, or morning grogginess. Avoid sleep meds unless absolutely necessary. And try natural options like chamomile tea, gentle stretching, or deep breathing exercises to wind down if you're on blood pressure. Meds track your readings and report any strange symptoms to your health provider right away. By staying informed and cautious with your evening medications, you're taking a powerful step toward protecting your health, preventing accidents, and improving your sleep quality. A few thoughtful changes can go a long way in making your nights safer and your mornings brighter. As we close, it's clear that even minor changes in your nightly habits can greatly impact your health and longevity. Now that you know about these 7 harmful sleep habits, it's time to take action tonight. Whether it's managing your medication schedule, adjusting your sleep environment, or paying attention to what you eat before bed, each small shift can support a longer, healthier life. Have you ever unknowingly followed one of these habits? Or do you have a smart tip that's helped you sleep better? Share your thoughts in the comments. We'd love to hear what's worked for you. And if you found this video helpful, remember to like, subscribe, and join our community for more practical wellness tips. Your path to better rest and better health begins right now.